into my patient's room and I closed the door for his privacy. Hi, I'm Helen. I'll be your student nurse for the day, and I hope you're doing well. And for us to communicate better throughout this process, can you give me a thumbs up for yes and a thumbs down for no when I ask you questions? Okay, good. So for right now, I'm just going to be cleaning your trach and switching out your inner cannula and your trach ties, okay? Okay. So before we start, I am going to ask you to give me a thumbs up if your name is Olaf Arendelle, born April 14, 2013. Okay, good. And do you have any allergies, especially to chlorhexidine, alcohol, or tape? No? Okay. So I'm going to make sure you're in semi-Fowler's position. And then right now I am going to scan the room to make sure that we have my emergency supplies. So the two trachs, a smaller one and the same size, so size 6 and 8. A size 8 inner cannula, a suction catheter, the trach kit, and a size 8 inner cannula, and then hand hygiene supplies, so like gloves and hand sanitizer, and my wipes for the table. Okay, so Mr. Arendelle, I'm just gonna wash my hands. I'm gonna prepare the table. I'm just letting you know just to update you, okay? Okay, so I'm gonna. And I'm going to make sure I get every part of the table. I'm going to let it be like that for about 2 minutes. And I'm going to let it air dry. Okay. And then while I'm letting it dry, I'm just going to take your vitals, okay? So your vitals seem to be stable and they're good, but your O2 sat is a little low, it's 96%. So we'll take care of that in a bit, but for right now, I'm just gonna listen to your lung sounds, okay? Okay, so I'm gonna ask you to take a deep breath. Okay, another one. Okay, and again. All right, and then one more time. All right, so it sounds like your breath sounds do sound like they have stuff in there, so we are gonna suction today. Okay, so I am just gonna push my hands, put new gloves on. I'm gonna bring my trach kit, my inner cannula, suction catheter, this over here. Just put it there. So first, I am going to switch out your suction catheter that's right here because I don't know if it's clean and I don't know who put it up, okay? So open this up. I'm just going to take this out. I'm going to take this one off, throw it away. This in here. Oh my god. Okay. That here. Okay, and I'm just gonna fill this up with the saline. And then I'm just gonna take this off. I'm gonna wash my hands. And then I'm going to put on new gloves. So because your O2 sat was low, the 96%, we want it to be at 100, right? So I'm just going to give you some oxygen. So I'm making sure it's at 15 liters, 100%, it's on. So I'm going to take off your oxygen now. Make sure this fits and it's on. So I'm going to give squeeze 1. Make sure there's about 6 to 8 seconds between each squeeze. 2. All right, and then 3. Okay, your oxygen is back up to 100%. Okay, so So now that we finished giving you oxygen, we're going to start the suctioning process. So I'm just making sure that it is connected and it is continuous and that it is up to 120 mmHg and it can be between 100 and 120. So I'm just going to test it out by just dipping it in the water and making it wet and adding moisture. Okay, it works. Now I'm going to try to make this process less than 10 seconds. And I'm going to stop when I feel you feel resistance or you cough. Okay? So then when I take it out, I'm going to twist it while I take it out. Okay? And that wasn't too bad for you. No pain. Okay, and did you want me to run it through one more time? No. So if I were to run it through one more time and suction again, I would wait at least 30 seconds between each suction. So before we start your trach part, I'm just going to listen to your lungs one more time just to make sure, okay? Big breath. Another one. And again. And then one last one. Okay, we're all good. Okay, so now I'm just going to take off my gloves. And I'll wash my hands. And then I am going to open up my trach kit. Take out the gloves. Take out the wipe. I'm going to put in the inner cannula. Okay. And then I'm going to put saline in here. And then I'm going to put this on, even though I already have one on. Shiny side down. And then I'm going to put my sterile gloves on. Throw this away. So I'm going to bring this closer. And I'm going to put maybe 2 gauzes in here. And I'm going to grab the Q-tip without touching the inner cannula. Do one at a time. Okay, so now I'm just going to start. So I'm going to hold your face plate down, and I'm just going to grab it while only touching the outside. Good. I'm going to grab the new one while just touching the upper end. Lift it on. Okay, good. How did that feel? Good? Okay. So it wasn't too bad. So I'm just going to take this off. I'm going to throw it away. And now I'm just going to clean your trach, okay? First, I'm going to get the first Q-tip and I'm going to go under and then clean it. I'm going to throw this away and then get a new one. Under, throw this away, and then I'm going to get a new one. I'm going on top and then I'm going to clean it. Throw this away and then I'm going to get a new one. Clean on top, throw it away. Now I'm going to get the gauzes that were soaked. I'm just going to wipe. Throw this one away. I'm going to get this one and I'm also just going to wipe. Okay. Now I'm going to get one of the dry ones. And I'm just going to pat it dry. Okay. Now I'm going to get another one of those split gauzes. I'm just going to put it under just to capture your secretions. Okay. Was this process at all uncomfortable for you? No? You're good? Okay, so I'm going to put your oxygen back on. But I'll be right back. So I'm just going to get my nurse helper, or my other nurse, to help me switch out your trach ties, okay? Okay, so Mr. Arundel, I brought my nurse. Her name is Ray. This is Nurse Ray. And she's gonna help me switch out your trach ties, okay? Okay, so first I'm gonna untie this one. Take this one off. I'm just checking your skin at the same time to make sure that there's no redness, it's dry, and it's clean, and it does look clean. There's no wounds, so I'm just gonna sweep this through. Okay, and I'm just gonna put that on that side. I'm gonna put the new one also on that side. So then now I'm gonna hold on to your face plate, and then Nurse Ray will take out the old tie, and then she'll weave the new one through. Okay, and then we're just gonna make sure that there's about 2 finger length through. So one on this side, and then Nurse Ray, could you check if there's 2? Yep, perfect. Okay, thank you. So then now I'm just gonna put your oxygen back on. And that process wasn't too bad, Mr. Rando? Good, okay. So I'm checking your O2 stat and your vital signs are stable. You're at 100%, so that's good. And I'm gonna put the call light right at your finger, just so you can call me whenever you need me. Do you have any questions right now? No? Okay, so before I leave, I'm also gonna switch out this suction catheter with the new one, just so I know next time it's clean and that I was the one that switched it out, okay? Okay. So I'm gonna clean up around here. Throw this all away. Okay, so after I cleaned up in there, I'll come out and then I will document everything that I did in here. I will also document that the emergency supplies, so like the 2 trachs, a size small and same size, were there, so size 6 and 8, and then inner 8 cannula, a suction catheter, hand hygiene supplies, and then also the wipes were there. And I also document how the patient tolerated this procedure, or the process. So his pain was pretty good. I'll also document the amount of sputum, the color, the odor, and the consistency of it. I'm also going to document that the vital signs, so the O2 stat, and the amount of oxygen he was on was good. And his vital signs were good except for his O2 in the beginning, but we fixed that by giving him oxygen. And then I'm also going to document how many times I suctioned, and then his lung sounds before and after suctioning, and then his skin assessment, which was, there was no redness, it was dry, and then also his site assessment. It was clean, there was no signs of infection or redness.